My name's Phil, and I have aphasia. But my goal is to talk about other people's stories too. Remember, it's your voice. There's no way around it. The only way to get better is to practice. Now, you don't have to be like me, but you need to be able to talk and listen to other people's stories too. Like this one right here.
Yeah, I'm Kacey Kaiser, and I'm a speech language pathologist currently working with the adult population.
So, first of all, thank you so much, all of you guys.
Yeah.
I don't, I mean, it was being there, really, my phone goes off. Because of the fact that if that wasn't an station there, a place to live with everybody else, I wouldn't have made it there. I mean, first thing I want to know, I say rehab now. I can say the word rehab before.
Yes.
As
I
a rehab,
remember when we were on the phone, you were rehabilitation was a
yeah,
really that was a hard
rehabilitation.
one.
It was funny because I was like, I knew the place it is, but I'm going there. And I thank you for all the apps.
No problem. I'm
Um,
glad that you still use them. They
oh
were
yeah,
really
all the
helpful for
time.
you when you were there, and I'm glad they're still helpful.
Yeah. The fun thing is, first of all, I'm gonna get this question. Speech teacher, I'd say speech pathologist, but I say it wrong all the time. Speech teacher need them. I don't understand how anyone think because I do a lot of meetings with other people, and I'm very vocal, as you probably know.
Yeah.
And I'll tell people, listen, if you don't have a speech teacher, then you'll never get better. You can't. There's no way around it. No magic pill. No. There's nothing, and I don't understand how you do that.
Yeah, I'm glad you feel that way. I'm glad you feel that I was important. And I think that everybody heals differently from
Yes.
different ailments and stuff, and everybody has a different like journey as far as especially stroke recovery goes. And there is a such thing as spontaneous recovery. So like as the brain heals, there's spontaneous recovery, but our job is to make that recovery better and quicker and education like educate our clients. So like the apps that I gave you, the tricks that I tips and tricks I gave you and your mom, that's all stuff that people wouldn't be able to do on their own. So I'm glad you feel that I was helpful. That's the purpose. That's
Yeah.
great.
I mean, I don't think anyone that I would go this far so quickly.
Yeah, I mean it's been how when was your stroke? You
Two,
were I just
three
looked
years
back.
ago. 3 years.
Okay, it was like October of 2022 or
Y-
like just before like the summer of
Yeah.
2022 and
Yep.
you came to us in October. Okay. Yeah.
I was then there until
February.
so thing I find out dates numbers are not good for me right now. I'm getting better at that.
Hmm. Hmm.
I'll look at
Yeah.
the calendar and usually find out the dates, but
Mhm.
yeah, there's yeah the thing for me the fact it was a sanctuary. I mean, even though most of you had other stuff to do because the money my money didn't get there, but the fact that everyone said who's Trish, Chris, and Jay,
Mhm.
they all there. Listen, you have a second, go to the hall and do this stuff. It was cool, like,
Yep.
um, and it was good. I, I know that it was there to help me with doing better. So I wasn't not gonna not do anything. I,
Right.
and first of all, I love the fact that I can go to your microwave.
Yes. Yes, you and your mom, you had open access to the microwave.
Yeah,
But like you were saying, like you could come down to the gym whenever you wanted, It
yeah,
was like you could come down and we were like a getaway for you, because it's things got crazy out there and like we wanted you to have some place to just come even if you were just hanging out, like if we were in there, like you could be in there hanging out doing like your stuff on the tablet, and I think that that was like a really good like relationship that we had with you while you were there.
Yes, and it was cool because first of all, can I ask you a question?
Yeah.
What was I like?
Well, when you first got there, and it's funny that you said you're having trouble with like the dates and like numbers and
Looking
stuff
better at
because
that.
yes, but that was something I remember was very difficult for you then too.
Hmm.
But when you first got there, you could like there was no you were trying to communicate, but as far as like expressive language goes, that was very challenging for you. And I don't it took us a while to get like meaningful words from you and like especially like a string of sentences or like even just a sentence. That was very difficult. So it was hard for you to understand or to understand you and receptively too, like you were having trouble. That was, I do remember that receptively that was better. You were better at understanding. It was easier to get a message across to you than it was for you to communicate yourself, which is helpful that receptively that was a little bit better than you could communicate and you could speak, because it was easier to like train you and like improve your language expressively. But I mean, it was very challenging in the beginning.
Yeah,
Not that you were a difficult person at all. You were great to work with, like seriously excellent. Like you, because you were so motivated, because you were like, I want to get better and I want to get the heck out of here.
yeah,
Um, and your mom was such a great advocate for you too. So you had like a lot of really great things going for you. So you were a great patient, a great client to have. But like your stroke was that was a doozy. It was a pretty significant one. Yeah, I know. Yeah, your skull got put back in. I
yeah.
know. And you had to wear that. You had the like the helmet, the soft
Helmet,
helmet.
helmet to put it up right here.
Yep.
You know something about that? Before I came to you guys, Westgate and Bryn Mawr, one
Hmm.
of the guys he's like the helmet real bit like this. He's like, come here a second, and cut it off. He's like, I can do this the whole time, and it's the helmet. It's a
Oh, it
little
was
like
in
this
your
now.
eyes.
Yeah, it's like
Oh
this
my
now. It's like
goodness.
I said, why'd you tell me the whole time? I said, there you go. And then that's when I came to you guys. I said, because the helmet was like this the whole time, like I couldn't see anything and I know what's going
It
on.
was so big, yeah, and like hanging over. Aw.
Do you remember the time that play bad speed, fast or slow, like, and now you can have subtitles too. Now remember, subscribe please.